America's children are anxious and depressed. In fact, as many as 30% suffer with anxiety that interferes with their day-to-day functioning. Last month, a panel of national health experts recommended anxiety screenings for children between the ages of 8 and 18 years old. And recent violence is leaving children and parents looking for help. Dr. Tammy Benton is psychiatrist-in-chief at Children's Hospital of Philadelphia. Dr. Benton, thank you for talking with me. Why is it that we're seeing nationally suicide rates go up among children and teenagers?
It started before this pandemic that we were seeing higher rates, and they appear to have accelerated in terms of how many young people are presenting in crisis seeking care for suicide attempts. But we were actually starting to see significant increases in the amount of stress that young people were experiencing prior to the pandemic. Much of it they identified as school stress and more social pressures. And this feeling that they weren't going to be successful. During the pandemic, young people experienced more social isolation, disruption, and then so much of how young people handled the pandemic had to do with what was happening in their environment. So what was happening at home. If their parents lost their jobs or were experiencing more stress, or they had family members that were hospitalized or who went to the hospital and never came home, those kids experienced significantly more stress.
Can you talk about some of the numbers? We know it's increasing overall, but if we were to look at subcategories.
But when we look at the rates of increase, they've been higher for all ethnic groups. We also recognize prior to the pandemic, and this has held, that youth who identify as having more than one minority status, being a sexual minority or ethnic racial minority, were at significantly increased risk.
How do you know as a parent, like what's standard anxiety, manageable anxiety, and anxiety that is problematic?
Anxiety in itself is not a bad thing. When we start to become concerned about it is when we see impairment and change in functioning. So if your anxious child or your slightly anxious child was previously doing well, but the anxiety starts to interfere with social relationships, academic performance, other activities, you become concerned about significant changes in behaviors. Unfortunately, anxiety is easily treatable. There's so many preventive things that we can do around anxiety management, like teaching our kids to meditate or relax or to play or to identify feelings of anxiety and find ways to distract themselves, refocus, relax. And I frequently ask parents if they're concerned, start a conversation with your pediatrician or your primary care provider, and they can tell you whether the anxiety you're experiencing is something that you should be concerned about.
What's the role of social media in all of this?
It can definitely exacerbate mental health conditions or actually trigger them when they didn't exist before. Online bullying, targeting people, harassment, those kinds of things, of course, can really contribute to harming your mental health. But some of the other factors that are relevant in social media use just has to do with the amount of time that young people are engaged in social media. And it's disruptive to sleep, it's disruptive to nutrition, it's disruptive to other social interactions.
You look at the Buffalo shooting, you look at the more recent school shooting happening in Texas. You know, these are things that I think are filling young people with a sense of hopelessness. What advice do you have for them?
It's important that we talk to children about what has happened. How can we support each other? How can we talk about it in an honest way without getting into too many details and reassuring kids that we will do our best to protect them and that we will continue to work to protect ourselves.
Dr. Tammy Benton is psychiatrist-in-chief at Children's Hospital of Philadelphia. Thank you for talking with us, Dr. Benton. I truly appreciate it.
If you or someone you know needs help, call the National Suicide Prevention Lifeline at 800-273-8255 or text the word HOME to 741-741 or visit the website speakingofsuicide.com/resources.